So good to see all of you here. It gives me great joy to hear, because my office is literally through that door, the great hall being used. I am Dr. Guy Fish, CEO of the Codman Square Health Center. This is my 51st week on the job, so I'm pretty pleased to be here. By training and background, I am an internal medicine physician, but I also took time to retool to become a business person through business school, a little different business school than the alma mater that the mayor and I share, someplace down in New Haven. But that business school taught the value of public, private, and nonprofit sectors coming together to solve seemingly intractable problems. So it couldn't be with greater pleasure that I have that this convening of the Atrius Health Equity Foundation and the mayor's sponsorship of that program through the Boston Public Health Department is happening here, where healthcare is considered a right of all people, and the things that we need to do to support that are going to be happening through the Atrius Health Equity Foundation program. So with that, I'm going to turn it over to my close friend and colleague, Dr. Bisola Ojikutu, the Commissioner of the BPH. Dr. Ojikutu.
Good morning. It's so wonderful to be here and so wonderful to see so many faces out here this morning. Thank you, Dr. Fish and Codman Square Community Health Center, for hosting us today and for being a long-standing partner in our fight to advance health equity in Boston. I also want to thank Mayor Wu for her commitment, outstanding commitment to improving health outcomes amongst Boston residents. We're truly grateful for her visionary leadership and very lucky to have you as our mayor. I also want to acknowledge the electeds in the room. We have Representative Fluker Reed, who's here somewhere, yes. We have Rep. Russell Holmes. And we also have Council President Lucy Louis-Jean, who's here. And last but not least, I want to thank Dr. Ann Wong, who's President and CEO of the Atrius Health Equity Foundation. The $10 million that Atrius Health Equity Foundation has committed here is really groundbreaking, and it's an investment in Boston's future, so thank you so much. Okay, last year we announced Live Long and Well, and that's Boston's first population health equity agenda to focus on closing the life expectancy gap that's been persistent and pervasive for many decades in our city. And at that time, I cited data, actually 2 data points that most of you, I hope all of you, are familiar with at this time: 2 miles and 23 years. 2 miles is the distance between an area in Back Bay, where life expectancy is 92 years of age, and an area in Roxbury, where life expectancy is 23 years shorter, or 69 years of age. This is the largest life expectancy gap noted in our city, but it's not the only one. Between Back Bay and Dorchester, the difference is 20 years. Between Back Bay and Mattapan, the difference is 18 years. And if you zoom out and look at our city as a whole, we have concerning disparities by race and ethnicity. Life expectancy amongst Black people as a whole is 7 years lower than other Bostonians, and life expectancy amongst Black men is the lowest in our city. It's 10 years lower than any other men in Boston. None of these data are new, and they're not unique to Boston. This is a national tragedy, and it deserves the attention that we here in Boston are going to put forth to close these gaps. So under Mayor Wu's leadership, we're working together in partnership and collaboration to do something that we haven't done before. We believe that how long you live should not depend upon your race, your ethnicity, or your zip code. All Bostonians should live long, healthy lives. Closing this gap. Closing this gap will require new collaboration. It will require stronger partnerships, and it will require deeper investment in social determinants of health, like economic mobility. It will also involve continued and deeper investment in our healthcare resources. We all know what's happening federally. There is a significant threat to our community health centers that's on the horizon, with deep cuts to Medicaid in the future. We need to continue to invest in our healthcare resources with partners like Codman Square and the other partnerships that you'll hear a bit later, particularly those involving healthcare. It's also important for us to remember that health and equity doesn't begin or end within the walls of our healthcare facilities. Health and wellness are built and sustained within our communities. Residents in communities that are economically secure have better jobs, are able to access more resources that produce good health, they can buy better food, they experience less daily stress, and they have lower rates of chronic disease. Our residents have shared that this investment is necessary. As you look around the walls of this room, the back of the room, you'll see the community health needs assessment that we just performed here in Boston. And what that community health needs assessment told us is that people need more resources. People are living day to day, paycheck to paycheck. Some need to make trade-offs to afford essentials like housing and groceries while struggling to manage care for children. This is unacceptable. And particularly here in Boston, this resource-rich city that we live in, this is not the way that we're going to have things happen. Our residents need more opportunities. So we're happy to announce that $5 million in funding, half of the total $10 million that Atris Health Equity Foundation has awarded, is going to 4 partnerships. So over the course of the next 3 years, these partnerships are going to expand workforce opportunities for youth, they're going to connect residents to cash assistance and benefits, and they're going to improve nutrition security. The grantees are going to talk more about their programs in just a minute, but I do want to name them. The first partnership is led by the Community Builders, along with Codman Square Neighborhood Development Corporation and Talbot Norfolk Triangle Neighborhoods United. Let's give them applause. The second partnership is led by Link Health, along with the Boys and Girls Club of Boston and Harvard Street Neighborhood Health Center. The third partnership is led by Upham's Community Health Center and Dorchester Food Co-op and Jamaica Plain Neighborhood Development Corporation. And our last partnership is led by Immigrant Family Services Institute, or IFSI, with True Care Alliance Center and the Massachusetts Association of Patient Parents. So as Commissioner of Public Health, I truly look forward to working with each of these grantees to advance health equity in Boston. Now I'm going to turn it over to Mayor Wu.
Good morning, everyone. I just want to start with another round of thank yous. So thank you to all who have already been thanked, another 1,000% to our partners in the health equity world who have been with the city since long before the pandemic, really dug in during the pandemic and completely reshaped how we would plan for the future, and now have helped us map out how to make the best possible use of every bit of resources that we have. Thank you for all that you do. I want to recognize that so many of the folks in this room who are here wearing your health equity hat, I actually see in all different spaces wearing all of your other hats as well. And that's just a testament to how involved the Boston community is, but also how much our focus on health really recognizes the connectivity and the intertwining of what you could call health or medical issues with every other way that we need to take care of families and our lives. So whether it's Pastor Kiki and Dr. Gabo meeting about housing and about immigration as well as health, or whether it's Ms. Gale and the partnerships on jobs and housing and green energy all in one conversation and here on health, or whether it's those of you who advocate for our young people, or we were out at a basketball court recently, or the tennis courts. Ms. Foreman has been at multiple of our announcements focused on young people and sports and activities and fun, and also here on health because it is one and the same. I also want to double down on the thanks to my colleagues in government. The most grateful, how blessed we are as a city, and how lucky I feel every day to have partners like City Council President Ruth Lejeune, State Representative Russell Holmes, and Rep. Fluker Reed in what they do every single day. They show up, they work hard, and on every issue, they are there fighting for community. And I want to make sure they get to say a few words as well, so whatever you want to say in a few minutes. And then just in terms of the team members who work for the city and who work for the Boston Public Health Commission, Dr. Basola Ojakutu has steered and led this organization through some of the hardest times for any public health organization, and she has also made the decisions to keep us laser focused on health equity. Despite all of the many pressures pulling in every single direction, our BPHC is focused on public health. So please join me in thanking Dr. Ojakutu. And can all of the BPHC team members give a wave so we can thank you as well? Thank you. When we say health, the first thing that might come to a lot of people's minds is going to the doctor, right? Or something that is very individualized, right? Are you eating the right foods yourself? Are you getting the right vaccinations? Are you taking the medicines or treatments that you need to address your particular personal issues? Come in, Councilor Morrell. Thank you so much to City Councilor Brian Morrell as well for all his partnership. So from a lot of people's point of view, health is something that individual people make decisions about and choose and have responsibility for. But we are focused on public health at the Boston Public Health Commission. Of course, that means every individual getting the services and resources that they particularly need for their unique and personal circumstances, but it's about a larger recognition that we can't be healthy as individuals unless all of our neighbors are healthy as well. Meaning, just because the healthcare exists, just because the program is there, just because we live in the city with the best healthcare in the world, with the hardest working healthcare professionals in the world, doesn't mean that every single resident feels they have the same access to those resources and can then live out their longest, healthiest lives. So that is what this coalition and this initiative is really tackling. The fact that health has to be about recognizing our shared humanity, that when we close gaps across the city, it helps everyone, not just communities who have lived with disproportionate impacts for generations and generations. Every single person in our city benefits when we make investments that close these gaps and lift up the health standards across all of Boston. It also recognizes that this is a collective, holistic effort. It's not just about the community health centers and hospitals, although we love them so, and shout out to all the work that they do. It is about the job training organizations. It is about the youth service providers. It is about all of those who do outreach and who do the work of public health, even though they might not have the MD or nursing credentials to their name. We need all of us in this together, and these four partnerships have the power to really model what is possible if we can bring everyone to the table, get everyone out into the community, and then stay focused on taking care of all of the various needs that add up to our whole community being healthy and therefore every single individual being healthy. So, okay, now I'm starting my notes. All right. So thank you to all of our incredible partners who are here today, Dr. Huang from the Atrius Health Equity Foundation, Dr. Gabo from IFSI, Ms. Stephanie Garrett-Stearns from the Community Builders, Dr. Martin from Link Health, Jay Trivedi, and of course, Dr. Fish for hosting us here today. We are focused every day on making Boston a home for everyone. And that means a lot of things to a lot of people. It means housing. It means high quality education. It means knowing we're safe when we're heading to work or to school. It also means access to reliable, thoughtful healthcare. So as a mom of now 3 kids who were all born in Boston, I have seen firsthand the amazing work that our healthcare professionals do. We are blessed to be home to the greatest healthcare in the world, from research and development and life-saving innovations to kind, compassionate, and attentive care. But all of us here today understand, and all of our healthcare partners across the city and the region understand, that proper healthcare starts well before something goes wrong. It starts with the circumstances that we're born into, that we're raised in, that we grow old in. It starts with access to the resources and supports and opportunities to live healthy, joyous, long lives. So that means ensuring that families here in Dorchester and in Mattapan, Roxbury, Hyde Park, across the city, have the skills and opportunities they need to secure good-paying jobs. It means keeping multi-generational households intact so grandparents can see their grandkids grow up. It means making sure that a mom can afford to feed her kids, access the doctor for those kids, make it to work on time, pay her rent without feeling like she's one visit away from being underwater. We know that empowering all of our residents to live long, healthy lives filled with joy takes more than investing in healthcare. It means investing in what makes people healthy: housing, access to nutritious food, economic mobility. These are the investments that we are proud to make in the city every single day. And it's important to note that we are making them because it is urgent and there's more need for this than ever in this moment. We are doubling down in the face of a federal administration that is clawing back access to critical, life-changing resources, that's canceling research that will save lives, who passed a bill that is certainly not beautiful, but will cut Medicaid coverage for thousands of residents and slash funding for community health centers. Today we're announcing that we're in the midst of yet another heat advisory for the city, lasting from today through Wednesday, what has become a regular occurrence for Boston throughout the summer. And so as the need grows greater, as the urgency grows greater, as the resources can be few and far between coming from the federal level, here in Boston, we are determined to continue pressing forward. We will hold ourselves to a high standard. And that's why we're making our city a home for everyone, not just the rich and powerful. That's why our administration here in Boston is taking every opportunity to stabilize housing by getting more shovels in the ground and more units built. It's why we're using every available resource to make sure that residents can access healthy, nutritious food. And it's why we're here today celebrating the first of 2 chunks of investments in economic mobility for families in Dorchester, Mattapan, and Roxbury. In partnership with the Atreus Health Equity Foundation, the Boston Community Health Collaborative, and the Boston Public Health Commission, we are awarding funds to 4 coalitions led by the Boys and Girls Club, the Community Builders, Immigrant Family Services Institute, and Upham's Community Care. These coalitions bring together community organizations that are already deeply involved in our neighborhoods, and they will help us train patient navigators who can help our residents access benefits, connect residents to financial coaching, job training, and childcare, provide English language instruction to hundreds of workers, and expand access to primary care and economic mobility coaching. You'll hear directly from each of our partners. So I'll just say in closing that when we say we're making our city home for everyone, we truly mean everyone. And we mean getting to the root causes that challenge our communities. Not just the symptoms, but digging in deep and putting in place the solutions that will last, that will actually reach our residents. We're investing in a Boston where all of our families know that we have their backs, that they have access to every single resource, support, and opportunity to live long, healthy, happy lives right here at home with their families and in the communities they know and love. Okay, otra vez un poco en español. Buenos días y gracias. Nuestra administración se centra en un objetivo: hacer de Boston un hogar para todos. Eso significa acceso a una atención médica confiable y reflexiva. Pero la atención médica adecuada comienza bien antes de que algo salga mal. Comienza con las circunstancias en las que nacemos, nos criamos y envejecemos. Comienza con el acceso a los recursos y apoyos y oportunidades para vivir vidas largas, saludables y alegres. Pero el acceso a esos recursos, apoyos y oportunidades no es el mismo en nuestras comunidades. Sabemos que empoderar a todos nuestros residentes para que vivan vidas enteras y saludables, llenas de alegría, requiere más que invertir en atención médica. Significa invertir en los determinantes sociales de la salud, vivienda, acceso a alimentos nutritivos y movilidad económica. Esas son inversiones que estamos orgullosos de hacer en la ciudad. Estamos redoblando frente a una administración federal que está devolviendo el acceso a recursos críticos que cambian la vida. Es por eso que nuestra administración aquí en Boston está aprovechando todas las oportunidades para estabilizar la vivienda, poniendo más palas en el suelo y construyendo más unidades. Es por eso que estamos utilizando todos los recursos disponibles para asegurarnos de que los residentes puedan estar alimentados y saludables. Y es por eso que estamos aquí hoy, para celebrar la primera de las 2 inversiones de $5 millones en movilidad económica para familias en Dorchester, Mattapan y Roxbury. En asociación con la Atrius Health Equity Foundation, el Boston Community Health Collaborative y la Comisión de Salud Pública de Boston, estamos otorgando fondos a 4 coaliciones lideradas por Boys and Girls Club, Community Builders, Immigrant Family Services Institute, o IFSI, y Upham's Community Care. Esto es lo que queremos decir. Estamos tratando las causas fundamentales de los desafíos que enfrentan nuestras comunidades de color, no solo los síntomas. Estamos invirtiendo en un Boston donde todas nuestras familias saben que tienen acceso a todos los recursos, apoyo y oportunidades que necesitan para prosperar y vivir vidas largas, felices y saludables aquí mismo en casa, con su familia y con las comunidades que conocen y aman. Okay, thank you so much, and I am very honored to pass it on to Dr. Ann Huang, President of the Atrius Health Equity Foundation.
Thank you, Mayor Wu, for that, for your thoughtful remarks and your powerful leadership in ensuring that everyone in Boston has the opportunity to live the healthiest life possible. My gratitude and admiration as well goes to Dr. Ojikutu and all of the dedicated staff of the Boston Public Health Commission for your vision, commitment, and to the Boston Community Health Collaborative for bringing together community and healthcare voices towards shared action for improving health. I also want to thank everyone who contributed to the work, including members of our Community Advisory Committee, Community Review Panel, all those who participated in community conversations over the past year, as well as the board and staff of the foundation. I also want to thank all of the applicants for this opportunity. Everyone put in an extraordinary amount of time and effort, and we received such innovative and powerful proposals. We were never able to fund all the applications we received, but we were incredibly inspired by the energy, creativity, and dedication that is deployed every day here in Boston. So I'm thrilled to be here on behalf of the Atrius Health Equity Foundation. We are an independent private foundation with a mission of closing the gap in life expectancy in Eastern Massachusetts. And we do this through large-scale investments in community-led collaborative efforts that address the social and economic factors that contribute to health. We share with the commissioner, with the mayor, with all of you, a belief that the 23-year difference in life expectancy is an unacceptable challenge, and it deserves urgent action and investment. We are delighted to be supporting the 4 partnerships that you'll be hearing from directly with $5 million in funding. With this funding, what I hope is that we will see residents receiving needed primary care services alongside economic coaching to help them meet their economic goals and also making it easier to achieve their health goals. I hope that we will be hearing about family members that are better able to take care of their health because they have a stable job. And we'd love to hear about the young people who will be trained and employed as patient navigators, working in their own communities to help others access needed benefits. Each of the partnerships seeks to improve health by addressing the direct connection between health and wealth. They also seek to rewire how we do things, building more collaboration and coordination between healthcare, social services, and community members themselves. We recognize that these are challenging times, and we believe that in these challenging times, this work, this types of partnership and collaboration is even more important than ever. So please join me in congratulating each of our grantees for bringing forward these strong partnerships and innovative ideas to improve financial well-being and health. I'm now going to ask each of the grantees to briefly introduce themselves. They're going to state their names, their coalition partners, and provide just a few sentences about their programs.
Good morning. It is a great day to be in the Great Hall. Mayor Wu, Commissioner Ojikutu, Dr. Huang, and the Boston Community Health Collaborative, and all of our neighbors and partners who I see here today, good morning. I am Stephanie Garrett Stern, Senior Vice President of Communications and Fund Development for the Community Builders. Our 60-year mission has been to build and sustain strong communities where all people can thrive. We are honored to be the lead partner for Healthy Heart Dorchester. It's a partnership also led by the Codman Square Neighborhood Development Corporation, T&T Neighbors United, and our gracious host today, the Codman Square Health Center. As you heard from Mayor Wu, Dr. Fish, there has never been a more critical time, so thank you for your service and your team. Healthy Heart Dorchester is dedicated to creating better health and better living for all who call the greater Codman Square area home. We are thrilled to be selected for Live Long and Well, and powered by resident leaders, our partnership will activate personal economic mobility, increase heart health, build lasting community power, and catalyze the built environment. We're developers, so we care about that part too. We are grateful for the leadership and generous support of the Mayor, BPHC, the Atreus Health Equity Foundation, and the Boston Community Health Collaborative. Thank you for your equitable leadership, and we are ready to get to work on those 23 years. Thank you.
Good morning. Can folks hear me? Yes. Excellent. My name is Dr. Alistair Martin, and I'm the founder of the Link Health program. I'm here representing our three partners, the Boys and Girls Club Boston, Harvard Street Health Center, and Link Health. We are going to be addressing the health-wealth gap directly. Why is that? Every single night in my emergency department, what I see as the biggest driver of sickness, of illness, is poverty. And that's because patients who are on Medicaid or Mass Health in this state are living on some $20,000 a year or less. And these folks are making decisions between paying for medications and food. At the end of the day, every single year, there's over $80 billion in unspent cash assistance benefit programs. These are things like rental assistance, utility assistance, SNAP, food, WIC. What we will be doing over the course of the next 3 years is recruiting and training young folks from the Boys and Girls Club Career Labs and converting them into certified patient navigators and deploying them across health centers at Upham's and Harvard Street Health Center to meet people where they're at in those health centers, in the waiting rooms, and enroll them in these cash assistance benefit programs. We are so excited to get started with this work, and we cannot wait to launch this program. Thanks, y'all.
Good morning, everyone. Thank you, Mayor Wu. Thank you, Dr. Ojikutu. Thank you, Atreus Health Equity Foundation, and our host, Codman Square Health Center. My name is Jay Trivedi. I am the CEO of Upham's Community Care, and I get the privilege and honor to accept this award on a powerful collaboration between Upham's, the Dorchester Food Co-op, and the Jamaica Plain Neighborhood Development Corporation. Together, through the support of the foundation and the city's Live Long Well partnership, we are excited to design a mobile program that'll bring healthcare access, food security, and economic stability directly into our neighborhoods, meeting our community members where they're at, especially for those who are facing systemic barriers. This work is about building trust, eliminating silos, and creating the conditions where our communities can truly thrive together. Thank you for believing in this work and standing with us. I do have to ask all of you for an assignment. Please shop at our only community-owned food grocery store, the Dorchester Co-op at 195 Bowden Street. Without our part, it will not continue to exist and support our communities. Thank you.
Good morning. My name is Dr. Gabo from the Immigrant Family Services Institute, and I'm so happy to be here with my combatant, Pastor Kiki, with True Alliance Center, Pastor Kiki, yes. And Reverend Daphne Germain representing the Massachusetts Haitian Parent Association in partnership with Boston Public School Hub Initiative. So, yes. It is our distinct honor to be with you all in this wonderful, what I call a transformative initiative. At a time where fear is going around like crazy. No one wants to talk to anyone. Everyone is trying to hide under the table. It is good to see bold and transformative leadership where we invite community members. Yes, well, we invite community organizations, community leaders to be part of the solution. So often, solutions are coming all the way up to us. But now, Mayor Wu, names and me, we are not good friends. Dr. Otu and HUS Health, you believe that for us to see changes in our community, we as community leaders who live in the community, who know the community, we need to be involved and we need to be the one to co-lead with you. So, to me, this is something so wonderful to see, to witness. And part of our coalition, we will be providing access, because in Mattapan, this is something that we do not have. Although we are such a beautiful community, very diverse, but access is a problem. So with this grant, we're going to provide access to our young people, to our families, to English classes, computer classes, access to health career pathway, and helping our young people to think about the job of the future. That's how we transform communities. That's how we transform society. So, on behalf of all of us here, we want to thank you, all of you who are here, and all of you sitting here and here, for believing in transforming our communities to the people who are part of it. So thank you so much, and we cannot wait to see the wonderful work that is happening in Mattapan. Thank you.
Okay, I feel like we should just maybe end it there. That was amazing. Thank you, Dr. Gabo. To put a fine point on what you just heard, though, I think the way that a lot of cities would have done this, even with the same amount of resources, even with the same organizations, is just say, we're opening up a program, submit an application, we're gonna put 15 different grants out the door. Everyone will get some funding to do what you do, and we'll hope that it adds up together. But the Atreus Health Equity Foundation, Dr. Ojukutu, BPHC, and our community partners and the Health Equity Coalition demanded that instead of just describing this as giving grants to do some work, this is about launching new and needed coalitions, about being greater than the sum of our parts. So I want to invite up our partners in elected office who've been such an important part of helping to form and push and shape these coalitions. They're going to do rock, paper, scissors, it's looking like. Cities first. We'll start with Madam President Rutu Lujen.
Russell said ladies first, so I'm up here. But I'm so happy to be with all of you this morning. Sorry I'm losing my voice. We had a weekend of parades and of different events around the city joyously. But this is such a beautiful initiative. I'm Ruth Louisiane, at-large city councilor and president of the city council. I want to thank you, Mayor, for your continued vision, for your continued work at centering the issues of equity. It is untenable. It is unacceptable, the gap in life expectancy. That is structural, and I want to thank you, doctor, for calling it out, because too often we are afraid to call out what it is. It is poverty. It is poverty that is killing our people, that is too often rooted in structural racism. So we know that. As a kid who grew up in Mattapan, neighborhoods in Roxbury and Dorchester, we can't evade the problem. We got to attack it head on. And that one of the reasons why this coalition is incredibly beautiful, it is because you can't have good health if you don't have stable housing. And so there's so much of this work that is interconnected, and you can't pay your rent for that housing that's going to lead to good health if you don't have a good job. So all of it is connected, and your kids won't get stable education if you are moving around from place to place because you can't afford the rent for that housing that is then having an effect on your health. And so all of this is interconnected to see so many of our warriors here in this fight. Stephanie, of course, my fellow combatant, Dr. Gabo and Pastor Kiki, is so heartening. And I don't know if y'all know, but we have the baddest and the best leading us here in the city of Boston, the Boston Public Health Commission, and Dr. Ojikutu. So, and just for those of y'all don't know, by bad I mean good, you know. But I can't tell you the number of times that I've been on the phone with Dr. O and with Dr. Simon, who have been helping me deal with a constituent who doesn't have access to resources or who needs help or a way to get behind the bureaucracy that is so often involved in our healthcare to just find a solution. So to both of you for what you are doing to help us break down barriers here in the city, it's incredible. To all of our community leaders here, you know, the mayor shouted out so many people, but there are so many people working at the intersections of this work that is so incredibly important. I see you, Marilyn, it's Gail, so many people who are here who are doing that, and I want to thank you. Recently, I was out for dinner, and this waiter told me that if you are not caring about your wellness, you're going to be caring about your illness. And then he served me a lobster roll and some fries. So he has some issues that he got to deal with, okay? That's his problem, not mine. But I think that we really do, I mean, it was a jolt to me. Because if we aren't caring about our health in all of the ways, both mental and physical, then our people especially will be tending to our illness. And so in this moment, may we, continue these investments, may we look out for each other. I spent my morning completely unrelated with a bunch of mothers who have lost their loved ones, sons, for a number of different reasons. And they told me that what they care most about is that we don't forget those who have passed, that we don't, whether it's been to gun violence, whether it's been to cancer, whether it's been to drug overdose. And the best way that we can remember those who have passed is by investing to make sure we can prevent preventable deaths. So thank you for everyone who is doing their part. I want to thank on the Boston City Council, we've been partnering with BPHC and the mayor in these investments, and so it's teamwork. It's not about, claiming who's doing what, it's about teamwork and just solving the problem. So thank you for everyone who's helping to solve the problem. I just listened to whatever Russell tells me to do, and Russell pointed at Councilor Worrell, so Councilor Worrell, you have the floor.
Thank you, Council President, for that, and good morning, everyone. My name is Brian Worrell, and I am the District 4 Boston City Councilor. Thank you, Rep. Thank you, Rep. First and foremost, I just want to thank the mayor for your bold vision and your leadership, especially during this time where so many are trying to discourage this type of work in our communities. We here in the city of Boston understand the importance of this work, and we are leaning in. So I want to thank your administration, the Boston Public Health Commission, and Atrius for leaning in, knowing what's at stake for our communities at this moment. So thank you. And a lot has already been said. I feel like I'm just going to be reiterating some of the great points that have been made by so many that have come before me, but it's all interconnected, right? This is a comprehensive plan that is needed at all levels, right? It's community leaders, it's the economic mobility, but it's also our healthcare providers that need to come together to create this coalition that's gonna lead to improved outcomes, that's not only gonna make our city stronger, but it's gonna be making our schools stronger and healthier communities. So I'm very encouraged by this investment, and I look forward to seeing the outcomes in the near future. I just want to introduce the Dean of the Black and Latino Caucus, our State Representative, Russell Holmes.
Good day, everyone. I'm going to begin by making a political statement because Michelle started with one, so I'm going to make one. And that is, Michelle said thanks to all of us, Brian, Brucey, and Rep. Fluker Reed and myself, because she says we're just pure fighters. But let me just tell you, I've heard Dr. Gabod say about just the climate. This climate, we seem to be focused on the president. But I'm going to tell you that at the federal level, we don't have a stronger advocate than our Congresswoman, Ayanna Pressley, and let's not forget about her in this fight. Because I can just tell you, this fight is at all levels. She is in a fight at the federal level, never forgotten. We're, Rep. Fluker Reed and I, we happen to share this area of the community here in Codman Square. We're in a fight every day at the State House. And our city colleagues, from our mayor to our city councilor, councilors, what I don't have to worry about is their values. We may not always agree on something, but what I know every single day is they get up and we are all fighting for you. I don't ever question the mayor's values. I don't ever question Brian or Rusi's values or Ayanna's values or Brandy's values, because I know their heart, and every single one of them is fighting to make sure that this city is the best it can be. And let's give them a round of applause, please. On this issue, I want to just always remind people, things that get measured get done. And we have to make a decision that this has been measured. This is something that is clear. This 23 years is unacceptable. It is unacceptable. And I am thankful to what Dr. Gabod said about how we have anchored this around our health centers and how we've anchored this around communities. I am from a small community in Mississippi, one of the smallest and poorest communities in the country. It was a community that Robert Kennedy went to when he was running for president because of the fact that the poverty was so great. And there are two, when you talk about poverty, you think about what really eliminated this war on poverty was the fact that we decided politically long ago to go and get and fight a war in Vietnam. And the dollars shifted from, hey, how are we going to address all these issues on poverty to, hey, how are we going to now have to address them at the federal level because we gave our money into a war. I can simply tell you, anchored around health centers is the right decision. I mentioned where I am from because the first rural health center in the country was started in my town, Mound Bayou, the largest all-black community in the country. And the first urban one, obviously, is Gibson Geiger. These two came together where urban and a rural center, health center, was a model that we now see, that we take for granted. There are, what, over 2,200 now, Dr. Fish? There's 2,200 health centers in this country, and they are under attack. When you look at, Dr. Fish gave me his annual report, when you look at the fact that this health center serves 85% of people here are black, or 80 or so. When you look at the fact that they ran at a deficit before the federal cuts, before what's coming our way, we need to, at every level, understand at a time when federal cuts are coming, his report says this is the largest amount of people this health center has ever served, more than 25,000. So when you see programs like this, anchored around our people, anchored around what is truly at the heart of our communities when it comes to healthcare community centers, this is the right way to do it. So that is why I stand here in full support. Thank all of the people and congratulate all of you. The fight just begins, just when you got the money. We now need to make sure that we actually continue to measure this and bring this number down in every single way. I can say, Doctor, I'm a financial planner, and it is at every level. It isn't just poor people who are making the decisions because they earn less than $20,000 a year. I have clients who make an awful lot of money, but still make poor decisions with what to do with their money. It isn't what you earn, it's what you keep. Make the right decisions about how you are spending, because some of this spending can't just be blamed on poverty. It is just very bad decisions. All right, so I didn't mean to end that way. Congratulations, everyone, and let's go get it done.
Okay, so I'm motivated. Are you all motivated? Are you all excited? Good, good, good. I think we have a little bit of time for questions or thoughts or comments. Anyone? Wow, the room is silent. This is shocking. We do, okay. Can you repeat that? Okay, why don't we have Stephanie come back up? She just wants to learn a little bit more about your program. Yes, if you don't mind.
Thank you for your question. So the Healthy Heart Dorchester partnership brings together housing providers, affordable housing providers, the Codman Square Neighborhood Development Corporation, and my organization, the Community Builders, and we use that housing as a platform to connect with residents, connect them with opportunity, upstream and downstream, addressing those social determinants of health when it comes to workforce readiness, direct access to care, housing stability, and ultimately economic mobility. Does that answer your question?
Okay, so what I want to end with is telling you all that at the back of the room we have information from our community health needs assessment. So those are results, that's data that we should all understand and actually, take some time and maybe take some pictures of so you can take home with you. This is what our residents need, a lot of which we've already discussed here, but I still want you to spend some time with that. I would also like everyone to stay in touch with us. We have your information. We'd like to give you updates on our progress throughout the course of this planning year. And then lastly, I just want to say have a great day. We're going to do a picture up here for those of you who are recipients and the electives, if we could take a group picture. And thanks everyone for coming.